So this is a trial looking at a combination of NC410, which is a collagen targeting antibody, in combination with Pembrolizumab, which targets anti-PD-1. And the idea of this trial was to essentially use the NC410 to try to remove some of the immunosuppressive collagen, as well as some of the immunosuppressive features of it, and to allow the Pembrolizumab to be more efficacious in these more traditionally immunotherapy recalcitrant diseases. The two contexts that we really focused on for the purposes of this trial was metastatic colorectal cancer, which was microsatellite stable, which is, again, traditionally thought of as something that's very recalcitrant to immunotherapy with a response rate of less than 5%, as well as ovarian cancer. We've enrolled more patients to this point in that metastatic CRC. There has been emerging literature that suggests, in particular, that disease that does not have active liver metastases tends to do better with these types of approaches. And so we've really focused our efforts on looking at that population. And so looking at this, the data we're presenting is on a little bit more than 40 patients, 2 of which achieved a partial response, which is sort of in keeping with traditional data. But I would say the really striking and impressive thing about it is actually our disease control rate. So over 50% of our patients had stable disease or better as their best treatment response. And many of these have actually achieved pretty good durability, with a lot of them actually remaining on treatment, which we just don't see in this heavily pretreated population. So that's very encouraging. Ovarian cancer, we don't have as much data on to this point, although we should in the next couple of months. But that has also been very encouraging, with 3 out of the first 7 patients that have been treated achieving a partial response. So again, I think encouraging in both these disease categories that traditionally have a lot of trouble with immunotherapy.